everyone. It is Wednesday, which means office hours. Thank you so much, everyone, for joining us on a very busy month. I know September is a hard month for so many people, so it's wonderful to see so many of you join us for the presentation today. As I mentioned in the reminder, we have some folks from the Bureau of Children's Behavioral Health who are going to talk a bit about data dashboard that they're building. And so I will let Abigail and Aubrey introduce themselves. I'm just looking for where you are in the, oh, you turned your videos on. Awesome. So sorry. I was just looking for where you were in the series of squares. And we'll kind of pass it over to them. I'll still be here if folks have questions. I think we'll have pretty robust conversation. So if there is a series of questions for me, I'll just make a little breakout room and I'll be in my own law office, so to speak. So I'll pass it over to you.
Thank you, Danielle. Hello, everyone. My name is Audrey. And my counterpart here with me today is Abby. We are both part of MDHHS. We work within the Bureau of Children's Coordinated Health Policy and Supports. It's quite a name. So we are going to call that BCHPS. That'll be referred to throughout the presentation. So just so you guys know what we're all talking about. I am going to share my screen. Maybe. There we go. All right. Is everyone able to see this slide deck? Okay, I see some nods. Perfect. Thank you. So to get started, I just want to give you guys some background information. So our bureau within MDHHS was developed in response to a lawsuit, a class action lawsuit that was filed against MDHHS back in 2018, I believe. The lawsuit alleged that the specialty behavioral health services in Michigan were not providing services as we were contractually obligated to. So this slide here kind of just gives an idea of how the system currently works and all of the factors that play into that. So in the middle, we have the Children, Youth, and Families of Michigan. That is, of course, our client base. So that's who we're trying to keep in mind at all points throughout our decision making. And then all of the circles around the family are the systems that they may interact with. And this is, of course, not a comprehensive list. This is specifically looking at specialty behavioral health systems. So we've got MDHHS, tribes, we have 10 PIHPs in the state, and then 46 community mental health organizations across the state. In addition, there's, of course, school-based services, psychiatric hospitals, Medicaid health plans additionally, and then also child welfare. So the families that we're working with interact with any and all of these systems at any time, and essentially the litigation alleged that these systems were not working together effectively to treat the mental health and behavioral health needs of children in Michigan. So I just want to stop there really briefly. The litigation is not finalized at this point. There is not a final settlement yet. So there's limited information that I can share about that. But are there any questions at this point, just with the information and background about how we even came to be? Okay, hearing none, we will move on. And feel free to, if you do end up with any questions, come off mute. You can interrupt. That's totally fine. You don't have to wait until the end of the presentation. This slide is very text heavy. You guys will be getting a copy of this PowerPoint after today as well. So I'm not going to read through this. Essentially, it just says that there are 3 divisions within this bureau, BCHPS. Abby and I come from the Center Division, the Program and Grant Development and Quality Monitoring Division. More specifically, we are in the Data Monitoring and Quality Improvement section. So the main project that we're working on right now is a data dashboard. So as part of the settlement agreement, we are required to develop a public-facing data dashboard that reports specifically on specialty behavioral health services. So specialty behavioral health services are those that are provided by the PIHP and community mental health system. So regular, and I'm using air quotes here, regular behavioral health services would be like outpatient counseling, maybe that you could get through your Medicaid health plan. Once a child is categorized as having a critical or a severe behavioral health impairment, then they become eligible for specialty behavioral health services. So we say that mild to moderate needs kind of are filtered through the Medicaid health plans, and anything above would be filtered through the specialty behavioral health plans. So the goal of our dashboard is to provide data in a user-friendly format, again, keeping in mind that our audience is the public and the people who are using the behavioral health system. We aim to provide data in a way that helps families make decisions about the care for their children. And then on the bottom of this slide, we just have a timeline. Today, this Health Equity Council presentation is the third bullet, I suppose, along our timeline. And this is just to show that we are trying to be very intentional this time. The state has a history, and I'm sure many of you have encountered this in your careers. The state has a history of working on projects and then presenting them to the public in a neat little bow and saying, here, this is what we did. How do you like it? And we, in our group, tend to believe that there's less buy-in and the product is less effective when the audience it's intended for are not included from the very beginning. So we have been really intentional to get feedback via user acceptance testing from people with lived and living experience in behavioral health. So we did our first round of that in May. We have been updating the dashboard based on those recommendations since June. And we've got this presentation today. We will be doing our second round of user acceptance testing with people with lived and living experience in hopefully November. And then the last bullet here is targeted population outreach. And I want you guys to kind of keep that in the back of your minds because we want to I hate the word target. It's really it's an aggressive word, but I can't think of a better one right now. So we want to work with specific populations and get feedback on the dashboard. So thinking of tribal populations or specific racial and ethnic groups that might have a vested interest in this, we want it to be as effective for the people who live in Michigan as possible. The next, Abby is going to take over. She's going to show you a screenshot of our current dashboard as it stands now, and then give you just a little bit more information about some other projects that we're working on. And then we'd like to open it up for discussion. If there's anybody who's interested in this project, we can get contact information and make sure that we keep you abreast of it as it moves forward, or if we have user acceptance testing rounds that you might be interested in the future. We really are trying to get as much feedback from the people that this will actually benefit as possible. So if you can just keep that in the back of your mind as we're going through these next few slides, I think that would be very helpful. And Abby, I will turn it over to you. Just let me know when you need the slide changed.
Okay. Thank you, Audrey. Thank you, everyone, for coming to listen. So this is an example we have right now of, obviously it's a draft of our data dashboard. So as Audrey mentioned, we had a user acceptance testing a few months back. So that involved providing our dashboard to a select group of people and kind of walking them through different scenarios and seeing how user-friendly it was and any information we really could gather. So this is our most recent iteration based on the feedback we received from that user acceptance testing group. So we have decided to try and go for a kind of storyboard look to this dashboard. So you can see where your eyes like immediately draw and the arrows show you what leads to what. So I will just walk through what we are looking at here. So this screenshot of the dashboard is about meeting the need. As you know, Audrey said, that is kind of the whole purpose of this dashboard. So in the first box in the upper left, you can see how many youth need services in Michigan. So our data suggests that about 8 to 12% of Medicaid eligible youth need these behavioral services. Excuse me. And from there, how many youth that need the services are actually receiving them. So we can see this little kind of gas gauge is what we call it. About 6.7% of Medicaid eligible youth are actually receiving these services. So we have not yet reached that number of how many need it based on what's shown in this dashboard. And following down to the bottom left, we can see what does this mean? So we're really trying to not just throw numbers at you with this dashboard, we're trying to tell a story. So what does this mean? It means that Michigan behavioral health system serves about 67% of the system, the youth and that would benefit from these services. So clearly we see that there is remaining estimate needed there. And then hopefully that blank box that has nothing in it yet would have some links that would show initiatives, how we are trying to fill that gap, meet the need. We don't just want this dashboard to be point blank showing data. We want to have some solutions offered, and we want people to know what's going on behind the scenes, to know what we are possibly doing to make it better. And so this is a screenshot, so it's not interactive, but you can see on the right that we have this map. On the dashboard, you will be able to, I know it's kind of small, but dial down in those filters to see across the counties what percent of youth who need the services are receiving them. So for example, in this map, the darker counties mean they, are receiving them at a higher rate. And you will be able to filter by age group, gender, race, and potentially other filters. So it will be interactive in that way. And we are just hoping that this will provide it'll be interactive, it'll provide a story, so it doesn't just feel like it's confusing to follow and throwing numbers at anyone. We want this to benefit people when they are searching for information and searching for help. So this is our most recent iteration. We will have, I'm sure, more changes with the next UAT testing, because that has been incredibly helpful since we kind of end up having this sort of tunnel vision because we stare at this dashboard all the time. So yeah, Audrey, you can go to the next slide. Thank you. So the purpose of this dashboard, I know I just walked you through a screenshot. So the purpose is to increase the availability, transparency, and utilization of information and data to support children's specialty behavioral health services. So I just read that off this slide, but just to explain something major in this lawsuit, we just really want to be transparent about how we are helping the youth in Michigan. That is why the dashboard will be available to the public. The data will be updating in pseudo real time, as frequently as we can get new data, it will be updated. So that is all about our transparency that we're hoping to show. And this data will then be utilized to make decisions. So from like a policy standpoint, it's not only going to be like for the public, we also are going to be keeping on top of this and seeing our trends and how we can use this data and the visualizations that will be on the dashboard to make data-driven decisions. Oh, thank you. So these are goals, 1, 2, 3, kind of as they pan over. So integration and planning, develop and execute a plan for meaningful partnership with those with lived experience. So our kind of number one thing with this dashboard, as Audrey mentioned, with our user acceptance testing and hopefully the target outreach, is that we want from the ground floor up to be speaking with people with lived experience and taking the things they say really into account instead of putting out a product and hoping it meets their needs, because how are we supposed to know those without having their input from the beginning? So that is a really big part of our bureau of, like, Audrey and I in our sections work, is integrating that youth and family voice really at whatever point we can, because it helps us so much. With data and analytics, we want to provide quality and trusted information about children's public health services in Michigan. So we are just trying to present the data in, like, I don't want to say the most simplest way, obviously, but the most comprehensive way so that people can understand it and make decisions, you know, just come and look based on that transparency at this dashboard. And as I mentioned on the slide prior, quality improvement is a great end goal of this. We want to empower end users to make informed database decisions and use this data to improve the quality of all of these systems. We really just want this to be a, like, bouncing off board where we can make data-driven decisions. I'm being a little redundant there, but yeah. So as Audrey mentioned, and we'll get into this as we go into our discussion right now, but we are really committed to ensuring that youth and family voice is a major part of this data dashboard. So that's a reason we're speaking with you all today, to see if you have any connections, and if you guys would like to provide feedback, any input that could help with this data dashboard. We have been working on it for a while, but it still feels like it may be it's still in its working phases. So yeah, a couple things we've done. We have reached out, Audrey and I have a form that is attached, actually, where it says this brief form in the bottom. It is kind of like turned into a Rolodex for us, where we are gathering names and information of people with lived experience that are willing to help us in whatever way possible. And I don't want to say help us, because actually we are trying to form a partnership with them. We don't only want information from them. We would like to work in conjunction with them. But so in this brief form, just there's really some basic information: name, email, where you are regionally in the state. And then Audrey and I have been setting up one-on-one or two-on-one meetings with these people that are willing to speak with us, and getting their story as much as they are willing to share, and then asking them how they are interested in partnering with us. And some of the things would be surveys, focus groups, and a passion project of Audrey's and mine is art we are looking for. So with this data dashboard, there will be a kind of a homepage that you'll go to. And I don't want to use too many of Audrey's words, because I've taken a lot of this from her, but instead of having a photo, you know, of just like the typical happy family, we would really like to have something more realistic. I don't want to say realistic, but have something that comes from families in Michigan. So something really exciting. We've been asking people if their children or youth that have lived experience in the system are interested in artwork, if they would submit that to us, and that would be really important and powerful for us to include on that front dashboard. Yeah, Audrey, you can help join in. I'm sure I forgot a bunch of things, but
No, I think you did great. I just want to add that we will also be sharing a flyer that has a QR code to the brief form that Abby has mentioned. So it is a Google Doc. It's just a quick survey that asks for demographic information, and also if you would be interested in partnering with us in the future on these projects as they come up. So the data dashboard, of course, is one project that we are working on actively, and we have already started to partner with providers as well as caregivers of children with lived experience. But that won't, there are many other projects that will come up in the future that we're not necessarily aware of right at this moment. So Rolodex is a perfect term for it, because every time something new comes up, what we have done is reach out to all of those people who said, yes, I do want to participate in the future. And we say, hey, this is what we have going on next month. Are you still interested in participating? And does this fit into your life? And that gives people the opportunity to kind of decide how much and if they want to help us out rather than feeling coerced into it. We're trying to make sure that they feel like they have the decision-making power. So this artwork, this is one of these projects. This one is kind of ongoing. We're looking for artwork from, it could be from caregivers that have children with lived experience, or caregivers who have been in the behavioral health system themselves, or from the children themselves. We've gotten some really cool submissions so far. And we intend to use them as like a slideshow on the homepage of our dashboard, but also in future publications or on our website. We would like to have a page specifically dedicated to all of these submissions. And lastly, I do just want to say that everyone who participates in these projects is getting a stipend. It is a payment of $75 per hour that is meant to include any like childcare that they might have to obtain in order to participate in one of our projects, or that's meant to be like a comprehensive rate. So we do provide $75 an hour. It could be in an electronic gift card. It could be a check if need be. It could also be a physical gift card sent in the mail. So that would also apply to any of you if you end up completing that Rolodex survey. And if you are interested in participating in any ways in the future, you would be eligible for that same $75 an hour rate. So just something to keep in mind. We want to make sure that people's time are valuable. We all are very busy. I heard some of that talk when I hopped on the meeting. This is a day of back-to-back meetings for us too. So we want to make sure that people are getting paid for the time and effort that they're putting into this. With all of that said, we will share in the chat these documents that were referenced, the flyer for that Rolodex, as well as the artwork project flyer. We'll put those both in the chat, but we also will send all of this out via email so that all of the attachments are together in one place. But with all of that said, are there any questions? We can go back to the dashboard page here, because I imagine this would be the page that people might have some interest or questions on. So happy to hear from anybody.
I have a question.
Sure.
How many previous slides are before that slide?
How many?
Yeah, because my question is, can you back up a little bit so I can review them again? Or I'm a little bit lost.
Oh, sure. Okay. There was just a few slides before this, so I don't think you missed much if you came in late, but. So this,
Okay.
Was there something you were like curious about in particular that I can touch back on, or did you just need to look at the slides for a moment each?
So I'm removed from maternal child health, so I didn't understand all the terms like lived experiences, like what specifically are we talking about?
Sure,
More
I
specific.
apologize. get so ingrained in I'm sure it happens to all of us, but like you spend 40 hours a week plus doing one thing and it like just kind of becomes your second language. So lived experience is the accepted term right now for people that have behavioral health needs or are involved in the behavioral health system. So it's saying they have lived experience in behavioral health. There is a new phrase that's kind of up and coming, which is lived and living experience, because this is lived as past tense, and any of you who have experienced either any behavioral health needs of your own, or if you have children with behavioral health needs, it is very much something that you are living and breathing every second of every day. So I'm trying to integrate that language into my verbiage, but yeah, so it's just lived experience with behavioral health.
Okay.
Does that
Would
make sense?
Yeah, one more, just a few follow-ups. Would that mean a child that's seeing a mental health therapist or has a mental health diagnosis?
Yep, they would absolutely be somebody with lived and living experience. Absolutely.
I got it.
So in that case, I just wanted to circle back to, there are many ways that somebody can be in the behavioral health system. So you could have commercial insurance like Blue Cross Blue Shield, and you
Okay.
could see a therapist yourself. You could have a Medicaid health plan, which is a state funded insurance. And that would also be like just seeing a counselor in your neighborhood. But then the prepaid inpatient health plans, or PIHPs,
Mhm.
there are 10 of those across the state, and they each hold a different region, and they oversee the community mental health organization specifically.
Mhm.
So you may have heard of a CMH in your county or nearby. Those are specifically for severe or specialty behavioral health needs.
Okay.
So the dashboard will be looking at the PIHP and CMH system as it stands right now, because that is what the lawsuit was targeting. But that's not to say that down the road we might not include other like Medicaid health plan data, but as it stands right now, it's just the PIHP and CMH system.
Okay.
Calvin.
So I'm trying to like grasp all of this, right? And I think Dana asked a good question. When I looked at the dash, the next page, not the background, the one very next, no, not that one either. No. The one you initially had it on. Yep, this one. So I'm looking at how many you need services, right?
Mhm.
And so how do we qualify, like who needs services, if you will? You know what I mean? Is this
Yeah.
all go ahead.
Well, so this was that first box that you're referring to. That is taking data and research studies that have been done across the nation. And that's why it has a range. So current studies and current research suggests that approximately 8 to 12% of kids are in need of behavioral health services. So that isn't something, that's not data that we came up with or that we got from claims or billing codes or anything like that. That is nationwide research for that box in particular. Then we take a look at our own Michigan Medicaid population in that second box to see, well, are we meeting that threshold? Are at least 8% of our Michigan youth receiving or behavioral health services? And we can see that we're not. We're at about 6.7% of our Medicaid eligible children receive behavioral health services every year. So that leads you to believe there is a slight gap, that we're maybe underserving children who need behavioral health services. Is that answering your question?
Yeah, yes, it do. And so what I was thinking about is another population that may be excluded in the data, like those who haven't been diagnosed. How do like we include those individuals that may need to be serviced as well, but that because they haven't been diagnosed, if you will.
Yeah, that's actually, thank you for bringing that up. So one of the, and I would love to hear any ideas you all have for this. One of the constant struggles that we have been in is how to provide information that is useful, and answer questions kind of preemptively so that people aren't left with more questions than answers, but also not totally overloading people with so much information that they can't make heads or tails of it. So I think it's a great caveat to put somewhere that these numbers may realistically be low because there are a population of children who are pre-diagnosis. So that's a huge, very important piece that a viewer of this would need to understand. Where do you have any thoughts on how to best include that?
So that brought me to my third thought, like when which was that third box, and which like what if because the numbers look great in that third box as of now, but when you add that population, what if it's the totally opposite? You
Mhm.
know, for quality improvement, what if it proved what the suit is saying to be true?
Mhm.
How do we mitigate that? So I got your question, but I just wanted to like finish my course of thought.
Yeah. I was so sorry to have interrupted, but you're absolutely right that the data that we don't have can always change the story that gets told. Um, and in this case, that's exactly right. Those kids that have not been diagnosed, who are maybe pre-system, are not necessarily included in this research. So that could definitely change the numbers. Um, in full transparency, we do want, so Abby mentioned transparency being one of the words that comes up in the litigation, but also it's one of our priorities. There is a very delicate balance of trying to share information that is accurate and thorough, without completely rocking the boat and sending everybody into an upheaval, because we haven't historically shared this data. So it is, I mean, it's going to be relatively new. We're trying to start the conversation now, but this isn't something we've done. So yeah, we really don't know how it's going to make the state look at this point, in full transparency, because this is data that has not really been looked at under scrutiny up to this point.
Mm-hmm. Okay.
So we're doing our best to be transparent, which is why we're having meetings like these, because we want to know where our gaps are. We want to try and identify those things as early as possible. But you're absolutely right that with that caveat included, that could certainly change the look of this whole page. So
I appreciate that because I was thinking transparency and accuracy, you know what I mean? So
Mhm.
that like we know there's inaccuracy. So I appreciate your clarification with regards to that. And so I would think that a part of that would be like understanding like when we talk about a behavioral health dashboard, I'm not for sure if this is the entire dashboard. I know this is a screenshot, but like helping people to understand what behavioral health is, that's one of the things, because a lot of people that are not diagnosed don't even really understand that, you know what I'm saying? So creating a bullet point, you know what I'm saying? I think that would be helpful, but also saying that we're looking to improve the accuracy, you know what I mean? So that people won't feel that um like like it has been feeling like people are coming in and getting information and just busting up on us, you know what I mean? And they're utilizing these terminologies, lived experience and living experience, like what truly are those things? So I think you are doing a good job in your process, so thank you. I'll let somebody else speak.
thanks, Calvin. I really appreciate it. I'm not sure who had their hand up first?
It was Joyce.
Okay,
I wanted to thank Calvin for that observation because that's what I was raising my hand. I just couldn't get my microphone on, stood up, and he said the exact thing I was thinking. And my concern is I look at those numbers, and I know those numbers as far as the state of Michigan, and particularly in my own county, that those numbers are going to look very different. And I think it's going to be a lot larger than that. I think probably maybe 25 or 30%. I'm thinking of in our school district, which has 6,000 students, about 20% of our students are designated special ed. That's a large number. And if we begin to compare the behavioral issues that we're having in schools, which impede learning, which has a lot to do with test scores when you can't get kids to focus, they have these barriers that have not been identified. I think schools are trying to do the best they can to do that. But when we begin to put all those variables in there, we're going to see that number is really going to be increased, and whether or not those kids are getting the services they need, I know they're not getting them. Even though we have a mental health worker in every one of our elementary school, every last one has one. So we're in cooperation with our CMH to do that. We have social workers and we have DHS in each school. We're trying to do everything we can to bring those in, but I know that number is undercounted because there's a great need, and that's why there's an impediment in the reading and all the other things that go along with that because of these needs are not being met. So thank you, Calvin, for bringing that up. You're right on target is where I was thinking.
thank you, Joyce.
Hi.
Hi, Jasmine.
Hey. Thank you so much for this presentation. This has been great. And my question is similar. Thinking about that first box, because everybody has mental health, and it does seem like a low percentage of need. And I just wanted to go back to that question, like, is this a composite variable that's defining that need, or like it's understandable, like you mentioned, you weren't the primary data collector or the primary person to analyze that raw data, but like what you're using it in the dashboard. So like what is this the number of kids diagnosed? And if so, like which kind of things are included or excluded, or can you share a little bit about what data informed the definition of youth needing services?
Well, in total truth, no. So we are working with a vendor that is building the dashboard, and they were responsible for this portion. And I thought when I saw this that I had a good understanding of it. But after Calvin and Joyce and your questions, I obviously need to ask that vendor specifically what this is including. My thought is, after hearing concerns that that's low, I'm wondering if this number is specifically for the specialty behavioral health services. That word specialty is not in that first box, so maybe it should be. And I'm just guessing, but the number of kids who need specialty behavioral health services that are in a severe or crisis level of need is going to be smaller than the total kids who need behavioral health services, because that might be including like commercial insurance, Medicaid health plan type of eligibility. So I need to find out some clarifying information on that before. So I will absolutely do that. I email Michael all the time. He is the one who did this, so I know exactly who to talk to. And I can also follow up once I find out some more information. I'm happy to reply to the group and let you guys all know what he said, just for clarification's sake, if that's something you'd be interested in.
Absolutely. And also just like if it is just defining specialty behavioral health services, just kind of what does that mean? Maybe on the side or somewhere.
Yeah,
just
absolutely.
so that people like me kind of get it.
No, that's so helpful. Thank you. Abby and I look at this for like 1,000,000 hours a week. So I feel like we are almost like blinded by it. We can't even see obvious stuff anymore. Calvin, go ahead.
So thank you, Jasmine. Just to add to what Jasmine had just said, clarifying specialty as well, what does that clarify? And like even taking a deeper dive in that, right? So when we look at ACEs, right, like can we monitor it by the ACEs score? And I say that because this is what I know to be true. Like a person who have been a victim of stabbing, or who have been beat up, or who have been shot, they suffer from what you call acute stress disorder, and they suffer from that for 30 days. And so if they're placed back into an environment where that isn't treated, it turns into PTSD. And so what you'll see in a lot of our community is underserved youth, if you will, either 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 they experienced it directly or vicariously, you know what I'm saying? And so like when we talk about specialty, that is something special that like we haven't been taking a look at, you know what I'm saying? So
Yeah.
just adding to thoughts, that's all.
I appreciate it. I definitely think we need to, I'm hearing that we need to have, maybe not necessarily on this page, but we need to have a way that is kind of dedicated to like definitions and like explanations, so that you're like, what the hell does specialty behavioral health mean? Let me go look that up. So yes, that makes complete sense to me. And it's so funny. So the first time we did user acceptance testing, um, we thought we had this like really great dashboard product. We were so excited to like work with these 7 people to do this focus group, to get their feedback. And not a single person could find the filter button on any of our pages. Like we just something that seems so obvious to us, and we just were totally missing the boat. So I really do appreciate all of your feedback and any thoughts that you have. Once you get a chance to like dive into this, if you're interested, once we send out these emails, like please, you have Abby and I's contact information on the last page. We are so happy to hear from you guys about this stuff, because like Abby said, we kind of get tunnel vision. So we really want to make this effective. And I don't want it to just be like another dead link on the state's website. I want people to actually use it. We're putting a lot of work into this. So well, thank you all. It sounds like that might be all of the questions for now. I'm just going to check the chat. Oh yeah, see, can a glossary of terms be produced? Absolutely, Dottie, good thought. Okay, well, I am going to turn it back over to Danielle. Thank you all so much for your time today. I really appreciate it. I will get these documents out to everybody, and if there are any questions, happy to hear from all of you at any point.
Yeah, thank you guys so much. We really appreciate all the questions. We need them. That's how it's getting better. So even if we're like, we have no clue, that means we need to look into it. So it's just helpful. So really thank you for listening, and thank you for your time.
Thanks so much, Audrey and Abby. It was really cool to see all of your hard work, and this is definitely a group that is really, dialed into what things are going on right now. They just decided to mow the lawn right in front of my window. Don't worry. But other than that, I'm here if you all have any questions. We'll be sure to get you all the information in terms of the slides that you saw today, as well as the flyers that were mentioned around the artwork. And if you want to kind of be on that information list as updates come out, you'll get emails from them, and just continue to be able to learn more and share. I'm really glad to see that, so much of this has been able to create a really good discussion. I know a lot of you have kind of tapped into either behavioral health, mental health, um, or just like wanting to have more access to data as a whole. So I hope that this was really helpful for you all, to just see some of the like behind the scenes before it goes live. Yeah, but that's really it that we had for right now. I'll stay on for the next like 11 minutes. If folks have questions for me and Lindsay, we're here to answer those. Yeah. You have a question, okay? Or are you waving? I don't know if those are waves or. Oh, bye, Joy.
Bye, everyone.
Oh. um,
See you later.
yeah,
See you.